Welcome to MedTalks, your go-to source for health information and medical insights. I'm your host, Juvenava, and we are bringing you the latest in healthcare. Whether you're looking to understand the basics of wellness, gain practical tips for everyday health, or learn about community resources available to help you live a healthier and happier life, MedTalks has you covered. Join us on this journey to better health, and remember, a healthier you starts with a single conversation. Stay informed, stay healthy with MedTalks, where every talk is a step towards a better you.
Start your day with purpose at Hot Cakes for Hope Care, a special breakfast that brings our community together to support patients who need health care the most. Join us Tuesday, June 24th from 6 to 9:30 a.m. at Jimmy's Family Diner. Bring your friends, family, and co-workers for a warm meal, great company, and the chance to bid on some incredible auction items. Every bite helps GraceMed care for those who need it most. Get your tickets today at gracemed.org.
Welcome, guys, to another episode of MedTalks. I am Juvenava, Director of Communications and Community Outreach at GraceMed Health Clinic. I am here with Brenda of Kansas Pace and also with Jennifer of Ascension Living Hope. How are you guys?
I'm wonderful. Thank you for having us
today.
Thank
you for being here. I'm really excited to learn about your program. I'll be honest, I don't know much about it. So can you talk to me a little bit about Hope?
Absolutely. Mm-hmm. Ascension Living Hope is what is called a PACE program, and Brenda will talk more about what that looks like. It stands for Program of All-Inclusive Care for the Elderly. We've been in Wichita helping folks who are 55 or older for over 20 years, and our goal is to help someone who needs medications, transportation, home care, a day center, a community of healthcare, but also a community of socialization that might normally look at long-term care placement, but that's not the right fit for them. That's not where they want to be. They want to be living in their homes with their families and their communities. We're going to help them stay there, but we're also going to provide that medical and service care that they need in one place with one team to make it easier for them to stay in the community they love.
That's awesome. Talk to me a little bit about PACE.
Absolutely.
Okay, yeah, so that stands for Program of All-Inclusive Care for the Elderly. It's been around since the 1970s. It started out in California. The Asian population did not want to place their loved ones into nursing homes. And so now there's over 100 PACE organizations across the country in 33 states. So there's one here in Wichita, and then there's a couple more throughout the state. So
yeah. This is really great to know because, so I'm going to share a little bit personal, is that I'm an only child. And so talking to my parents about what's going to happen when they get older, they live in Dallas right now. And so their idea is to move to Wichita so that we could take care of them. You know, in my culture, we don't want to put them in a home or anything like that. But there's this fear almost as an only child of what do I do with them, when they get older? So talk to me a little bit how the program works and how can people get involved in that?
That's a very recognizable situation for me as well and for the community. So for our folks, they have what we call chronic health conditions. They have diagnosis of COPD, heart failure, diabetes. They go to the hospital a lot. They utilize ER a lot, and they're not doing well. Their conditions are kind of really getting worse. And it's struggle for the caretakers, for folks like you. I'm working, I have kids, and I'm trying to take care of mom, but she needs to go to the doctor and she won't go. Or, she's sitting at home and she's not doing anything. She's getting depressed. I need help with bathing her, and I don't know how to do that. It can be incredibly overwhelming. Right. So what our program can do for that child and for that, that loved one is provide a place for them to feel safe and to be cared for. So we're going to come into the home and provide home care support. We're going to make sure that mom gets a bath, she has a meal, we can help with laundry and housekeeping, those kinds of things. Take that relief off, right? Yeah. You know that mom's being taken care of and she got a good shower today. And we have her aide is Brenda, and that Brenda always shows up on Tuesdays and Thursdays, and they build relationship. That also helps us to know what's going on with her health because we're seeing it in her home and we're seeing explain what's going on. Then she's coming to our center. Our center here in Wichita is over at Central McLean, down in Riverside.
Okay.
We're going to pick your mom up. We're going to bring her to our center. It's going to be our transportation, so a bus or a van that's comfortable for her, a driver that knows her and greets her every time. So we get consistency, which is so important when we're going to, make that relationship with someone. And then at our day center, we have 3 day centers. She can participate in activities there. We have everything from, of course, the beloved bingo, because everybody, y'all loves bingo.
Right.
You don't mess with bingo.
Exactly.
But we also have exercise classes. We have guests that come in. We create opportunities for what we call engagement, which is basically like, hey, let's go over here. They're playing cards today, or they're doing this craft today, or doing a nature walk. Let's participate in that. And that's getting mom out of the house. So she's getting up, right?
Yes.
She's moving. She's going to come in. You know that she's going to have a good day. While she's at her center, she's going to have a hot meal. She's going to get nutrition. So you know that she's had that part. And she's going to visit with her doctor at Hope while she's there. So we're going to see her. And that helps us with those health conditions. So as the spring comes right now, a lot of us have allergies, breathing issues. Someone with COPD or heart failure, that can really be a struggle. If I'm at the day center and I'm trying to do the chair exercise class and I'm having trouble breathing, our nurses are going to know that about me, and we're going to do some help for that. So we're going to help with maybe oxygen or a treatment, or talk to you and say, hey, your mom's kind of struggling right now, but so this is the medication we're going to provide, and this is how it's going to work. And so it's all in one spot. And so for our goal for our people who are in our program is to enjoy their life, give them a community where they feel comfortable, where they can make friends, and then give them a care team that they know. Our nurses, social workers, physicians, they see them all the time. They're available weekends and the evenings. So we don't have that fear of like, well, I can't go to the doctor because I can't afford it, or they're not, I don't know that person. They have that relationship. Sandy's my nurse. So I trust Sandy, and I'm going to call her when I'm not feeling well. And you, even though you live out of state, you can call Sandy too. And so that helps us keep that loved one in the home. Because again, the folks that we take care of normally would go to that long-term care placement, but we really see in Wichita especially, our elders want to stay home.
Right.
And they want to stay with their families.
Exactly.
They want to stay independent, and that's what we all want. So Hope can provide those services that they need at that higher level of care, but keep them living in their homes, and we're really successful with that. Our folks thrive. With Hope, they are actually, their health conditions stable. So we're going to manage that for them, and they're enjoying their lives. I hear all the time, Hope saved my life. We have a lady in the program right now who came in. Her grandson contacted us, and she's Spanish speaking only. They brought her up from Mexico, and she didn't know anybody. And he was really concerned because she didn't want to go to the doctor because she was scared of the doctor, and she doesn't know anybody in Wichita, and she doesn't have any friends. And he's like, she's upset, and I don't know what to do. So we brought her into Hope. And our folks that are in our program, we have over 300 people in our program. They welcomed her. There were folks that spoke with her in her language, welcomed her to the table, taught her like, hey, we're going to go out to lunch on this outing. Do you want to come? And at the end of the day, she was crying. And I was like, oh my goodness, what's going on? And her grandson explained to me that she felt so welcome, and that finally she had a place where she could see a doctor that would understand what she needed, that there were friends that she could make, and she was hopeful not only to get medical care, but also that social support. And she enrolled in our program, and she's been with us for over 5 years, and now she's great. And she recently got elected prom queen at one of our events. So she's doing really, really well. So it is it is traditional healthcare, but it is actually more of that. It is a sustainable option and a place for people to really build relationship and community. I think that's why we're successful.
And I think that's so important, because I know asking my parents to leave their home and moving to Wichita, which is going to be so brand new to them, especially like later in their life, there has to be a little bit of that fear that they have of like, what am I getting myself into? Or I know even having those conversations, they're very hesitant on wanting to, because they're like, I won't have my friends around or anything like that. And so to have a center that you can really build a connection and relationships with people is going to be very important. Earlier, you mentioned to me in a different conversation how Hope has been here for a number of years in Wichita. How long has Hope been here?
We've been taking care of folks since 2002. So for over 20 years. We started out in the old Park Lane Center down at Lincoln and Oliver. And again, now we're over at Central and McLean area. And then our folks have been with us Most of our staff actually have been with us for, 7, 10 years or more. So we are really dedicated, much like Grace Med. Our staff are dedicated to taking care of our folks, which I think is just great reputation and comfort to the people in our program. And for those folks who are living in Wichita, we are right there for them. We serve all of Sedgwick County, so all the way out to Goddard, Andover, up to Park City, et cetera. So it's not just the Wichita, it's Wichita and Sedgwick County that we can help people.
That's awesome. And it's great for the Wichita community. Grace Med is not just in Wichita. We obviously have different locations. What does this look like throughout the rest of the state?
Yeah. So if people are interested in PACE, I would suggest they go to the website for Kansas PACE, which is www.kansaspace.org. But there's PACE centers where Jennifer was talking about, they can go for meals, activities, see their physician. There's centers in Topeka, Lawrence, Emporia, Kansas City, Kansas, soon to be Olathe, Kansas. And then there's also centers with Blue Stem PACE in Hutchinson as an alternative site and McPherson, Kansas. So there's locations across the state, but people can go to that website, put in their zip code, see what's closest to them, and it will direct them to each of the PACE centers, the organizations across the state.
That's awesome.
Yeah.
And so the services are going to align in all locations, or do they vary?
They are the same in all locations.
That's
That's
wonderful.
the wonderful thing about the PACE program is that whether you're in Wichita, McPherson, or Topeka, you're going to get all of those services and that physician, that provider, that transportation, nutrition services all in one spot as well.
Okay.
So it's just a different healthcare company, right?
Okay,
Different,
exactly.
we're Ascension and Blue Stem, but we're the same family. And again, it's our same goal is to help those folks who are 55 and up. And we do have some qualifications to be part of the PACE program. So some regulations. We're serving the elder population. So 55 and older, living in those areas that we serve. We work with folks that have Medicaid, Medicare, they want to pay out of pocket, what have you. The great thing about what we do as a PACE program, which you'll find this with all PACE programs, is that we work directly with Medicare and Medicaid. So our participants don't have any out-of-pocket costs for services. There's no co-pays for medications. There's no hospitalization bills. There's no ER bills. And I know in Sedgwick County, when I talk with folks, that's a big barrier. I can't afford my medications. I'm only making $1,000 a month in Social Security. My rent is half
this is
that.
a barrier everywhere.
It is. It is. And it's bigger and bigger. So with PACE, because we are providing those services, we're going to take care of those bills for those folks. And so they can get relief from that. And that we never want a lack of financial to be a reason that someone's not getting care. So we help with that. That helps a lot, especially because as, those conditions change, maybe, I need to get a specialist. I need to see a few other folks. That cost becomes such a concern for our elders. So we take that on as a service to them to help that, just take that burden off of them. And it works really, really well.
And I'm glad you mentioned that, because that was going to be my follow-up question. It was just like, what do the finances look like for this? Because I know for someone like myself, I'm thinking about how much is this going to cost me? This is now a financial thing that I have to plan out. But you mentioned that you take insurance and and it's affordable. What other qualifications do they have to have in order to participate, or can anyone just participate in this?
You have to be 55 or older. I wish I could take care of folks that younger than that, but unfortunately we can't. So 55 or older. You have to be assessed by the state of Kansas for what is called a level of care. And so they're just going to make sure that you need this kind of higher level of wraparound services. So Grace Med does a great job of taking care of lots of folks. Someone who maybe is able-bodied, working, those kinds of things, and needs just a physician. Grace Med might be more appropriate for them, but someone who is 70, who needs transportation and home care and those kinds of things, that they'll be more appropriate for our program. So that's who we work with. And again, we work with folks with that Medicare, Medicaid. I will say one of the things that we offer, as well as PACE programs, Medicaid in Kansas, it can be kind of a challenge if you don't have it, or you're getting reviewed, and it can be a little overwhelming. So we provide staff support on that as well to help people understand that process and get them through. And then as folks are in our program, if they need more assistance, they need more home care, they need skilled care, what have you, we're going to take care of that. We'll arrange it for them. We're going to make sure they have the services they need, and there's still not going to be an increase of cost. So it's a really stable financial for folks on there. You don't have to worry about that because we're there to take care of you. And we just want you to get the care that you need and let us take care of the rest.
I can imagine that sometimes there can be a little bit of fear and, having someone come into your home and trusting them to work with your family and things of that sort. Talk to me about what the importance of building those relationships and what do y'all do to help those families feel more comfortable?
I'm so glad you asked that because PACE is a really big program. We've got your doctor, your social worker, your nurse, nutrition services, activities, lots of folks. And if you've been without care, that can be really overwhelming to have that many people. So what we do is we're going to start with visiting with folks and we're going to invite them to come to our center. We're going to bring you in. You can have a meal. Your family can come. You're going to see our site. So that helps kind of understand. And you're going to see people who are in our program that are going to welcome you and tell you, no, this is legit. And they're going to help you. I mean, it looks good, but I'm telling you, the meals are great here. And I think about, we have a woman in our program and she works with our physical therapy team. She comes in to work with the therapy team. She has Parkinson's. She's had a stroke. And she'll tell you, and she'll tell her visitors, I wouldn't be here without help because I come and I work for my PT team. They make sure that I'm moving. And so we can get comfortable with that. Our medical director is going to visit with you, with your family if you want, to talk about how we care for people. You're going to meet the team that might be your care team. And so that helps build that trust and relationship on that end. And so when folks do go through that with us, it's a few steps for that, but I think it really helps to understand what we do and to trust that we're going to take care of you because we want to partner with people for long term. We're lucky enough to be a part of senior care. We want to be there for the rest of your life and support you and your family. So we're going to create many opportunities for you to get to know us before you actually sign up with us and then go, okay, no, wait, this isn't what I thought. And that works really, really well. And folks are welcome to come to our center. We're over at 775 North Edwards, just around the corner from some of your Grace Med locations, or give us a call at 858-1111. Talk to Natalie and we'll be happy to schedule a private appointment as well. And we can do that at our center, or we can actually come to your home and visit with you and your family and just talk about what things look like.
That's incredible. And I mean, that has to feel I know that makes me feel a little bit more secure and a little bit okay, this isn't so stressful. There's obviously assistance for this. Have you dealt with any sort of challenges when it comes to promoting your services across the state when, for people to know about it?
Sure. Yeah. I know, and I'll let Brenda talk a little bit about what we're doing with the Kansas PACE program. One of the things is that because we serve a population that is smaller than, say, what Grace Med serves, it's a little bit of a specialized thing to find. It's not as well known as it should be, even though it's been around since the 70s and it's been in Kansas since 2000s. So we want more people to know about it and to share the message, which why we're so thankful to be here today. It is for folks who are 55 or older who would normally be advised to go to nursing facility long-term care. It's an option that's there that not enough people know about. And that's why I'm really excited that Brenda's been able to add to our information in the state of Kansas with the Kansas PACE program effort.
So the state of Kansas gave a grant for PACE awareness. So Midland Care, Blue Stem out of McPherson, and then Ascension Living Hope. So all three of the PACE organizations across the state are now working together to try to spread the awareness about what PACE is, because I think that's one of the biggest things is people just don't know about the service that's out there. What's available. There's a lot of different resources people just don't know about, and this is one of them. That there's so many different things that PACE provides to people, and I think too people are just afraid sometimes to try something new or do a new thing, and this is and the stigma sometimes of going on to Medicaid. I'm going to add a little bit about that. they don't know what to do to get onto Medicaid, or they don't know what's available. If they make $3,000 or less a month, they're going to be eligible most likely for Medicaid. And then there's no cost for this service. So they can get all of these services at home and at the center with this entire team of people, keeping them healthy and safe. So we're just really trying to spread the news about PACE and what it is. And it was great that the state gave this grant to help with that.
That. And there are over 1,000 seniors in Kansas that are getting services through our programs, and we would love to have more folks join our family. And then that helps to keep them living in their communities. Again, like you're talking about, you're an only child, I'm an only child. We don't want people to feel like they don't have help and that there's not a group that can help them. And again, we're going to provide those wraparound services, and we're going to be part of that family. So it is a specialized program, but it is specialized for seniors who need that higher level of care and want to stay living in their community. So it can be really, really successful in programs that have been established longer, like California. They have 30,000 people in PACE. And so we would love to see Kansas be the Midwest example of how successful this could be. And we really want to be there for folks. I personally have seen the difference. I think about my friend who lives in South Wichita. And when I met with him, he was very, very thin and very, very sad. He had been referred to us actually by Grace Med for needing a little extra help. He needed transportation. He needed social work support. He needed medical care. And it was just more than Grace Med. You really were like, he needs a little bit more. And that's okay. That's why we're here, right? That's why we're these community health agencies. We got his teeth taken care of. He was sleeping on a mattress with a hole in it, and he had a broken back. And so he was in a lot of pain because he didn't know how to get resources. He couldn't afford a bed. So our social services team, our physical therapy team got him a beautiful bed, hospital bed that he could sleep comfortably in. He started coming to our facility regularly, getting good meals, working with nutrition services, working with our mental health team to make sure that he was getting the support that he needed, and then taking his medications, understanding the why of it. And now I see him, and every time I see him, he says, "Hola, Jennifer," and he gives me a big hug, and then he talks to me about how fat he's getting, but he's thrilled about that because for the first time in his life, what he tells me, he's like, I feel healthy and I feel seen and I feel respected. And so his quality of life has improved so much with our program, and that's what we want to do for people. And we're creating that opportunity for engagement versus just sitting at home and watching television and feeling forgotten.
Well, and for him to even feel capable to do that.
Right? It's amazing.
That's awesome, because that means, he has a confidence, he's feeling healthy, like he feels good. And I think that sometimes we get worried that the older you get, you kind of might feel like you lose your purpose or that you lose your independence. And so it's great to hear that he has these aspirations and that he wants to do these things, because it's a testament of the work that y'all are doing.
Thank you.
To really say that you are not only building someone like health-wise, but you're also just building their spirit, and that's so important for that. So I'm glad that y'all do exist for patients like Rolando. You mentioned earlier that you do see people of multiple ethnicities. Do you have bilingual services?
We do. So we have over 300 people in our program, and about 20% of those folks speak a language other than English. So we have folks speak Spanish, Vietnamese, participant who speaks a beautiful mix of French and Haitian Creole and other languages. So we have services in those languages, providers that speak that language as well. And then at our day center, we have about 60 to 80 people that come every day. And it is a mix of everybody from all across Wichita, all the cultures. So they have someone to talk to. You have somebody that has the same experience with you, speaks the same language, which is so important. And I even, honestly, I go into the day center when I go into the office to visit with folks, and I enjoy it because I enjoy hearing stories. And I have learned how to play dominoes a lot better than when I started. And I have learned, how to speak my Spanish better. And that's because our participants, they're part of our family. They're like, "Hey, how's it going? How's your daughter doing? Oh, let me tell you. Can you help me with my phone?" Or, and those kinds of things. And we also have a group that is really dedicated to creating activities. So we have what we call the advisory council, and they meet monthly, and they say, we want to go out to the library this month. We want to go to Rib Crib. We would like someone to come in to teach us how to paint. And
Rib Crib is good.
Right. Rib Crib is fire. Right. And, but so they create their own community as well. So it's not just us saying, here, you're going to come in and we're going to do this for you. They're telling us this is what we need to thrive. One of the things that we did recently is we partnered with a local dance company, and they brought instructors into the center and taught them how to dance.
That's fun.
And then they did a program, and this relationship has continued. And they still come in and do classes and performances, and our participants love it. And that's something that they asked for. So again, it's a relationship versus just a provider. I'm going to give you this and do it, this kind of thing. They're creating the community they love, which makes them, of course, happier and more satisfied in their lives.
I would say that's one of the reasons this program was created. This model was to give people more autonomy over their care instead of going into a nursing home where they didn't have a lot of say about their health care or their choices. PACE really does give them those options.
And there is a place for folks, and there are beautiful facilities in Wichita, so I don't want to take away from that. There are folks that are doing really great work on that end, but that's not for everyone.
Right.
And we are another option that can really do well for this particular kind of family, community, or person. So not to take away, those services are needed, and I'm very thankful that they're here in Wichita. My parents are elders. They live in Florida. I'm looking at a PACE program in Florida, right? And so they'll be able to help me and understand that. And then, when they come to Wichita, of course, I'll just enroll them in my program, because why wouldn't I? Right. But it is a really great way for those folks. Again, when you're hearing, so if you're hearing from your doctor, if you're frustrated, you can't get the appointment, you're hearing from your provider, you're going to need more help. Ms. Smith, your mom needs more help. These are things are coming up with her diabetes, with her heart failure, those kinds of things. And I'm concerned, and these are all the places that you need to call to get her home health. And you need to take care of medications and all that. And it's overwhelming. A program like Hope, we're going to take care of that for you. And I really want more people to look at that in Kansas, because we will pick up that day to day. So you can be the son, you can be a person in the program and enjoy your life, and let us just partner with you. And that, I think, is the biggest thing about PACE, is that we let you enjoy the life you want in the home that you love, which is what we all want.
That's awesome. What does the future of PACE look like? Or what would you like for it to look like in the future?
Oh, I have many thoughts. I have big thoughts. In Wichita, in Sedgwick County, I would love to see more folks join our program. I know that there are many communities out there that can be served by this. When I visit with folks in the community, a lot of our younger folks, 55 to 65, who've had some big health things happen, and they are being told, that they need to go to long-term care placement. They need more, and they don't want to go, where they're used to living their life the way they want.
Exactly.
And I respect that. I would love to see them come into more PACE programs so that we can get involved in their care earlier, so we can help them stay in the community longer. It's a big need. And then for those folks who are like 80 and 85, and those grandmas, man, they just need a little extra support.
Right.
They just want to get out. And so we can really grow that too with your help to make sure that they're getting what they need and that support. So our youngest participant is 55. And our oldest is 97. So I want to see more 55 to 97-year-olds with that, and letting us help be their partners, because I've been doing this for almost 10 years and I've seen the difference it makes. And it's about that quality of medical care, but it's also about improving that quality of life. And I think that that's what we all want, is to live the life that we want in the direction that we want, and have someone walk alongside us.
Exactly.
So that's my hope, and to have more folks in Kansas know about it.
Yeah, that's really the biggest goal, is to get more people onto the PACE program and all across the state. So hopefully that's what will happen in the next few years. But, as the population's getting older, more and more people are needing services. So we anticipate it to grow as well.
Right. I always like to ask the people who I'm interviewing this question, but what motivates you every single day to do what you're doing?
That's a great question.
Yeah. So for me, it is the outcome and the difference, because I visit with lots of different folks all the time, and I visit with them and they are in a place of struggle. You know, either it's a health condition, something's happened, I was hospitalized and I was doing okay and now I'm not, and I'm scared, or folks are, you know, needing resources, and it is a son who's calling me going, I don't know what to do. Grace Med told me about you, but I'm just really overwhelmed and I got to go pick up the kids. And so we're in this place of just kind of darkness. It's a little low and I'm feeling overwhelmed. And to be able to visit with folks and provide them light, and then see those results and see that change. That's what keeps me going in this, is that,
awesome.
you know, getting that, you know, let's go from this place that's really uncomfortable and kind of scary, and then move you to this place of safety and then actual joy. That's what keeps me going, because I see it. And we are having prom in a couple of weeks, and I get to go to work in a prom dress and dance to Brick House. And I'm also really looking forward to that.
I love that. What about you?
I would say just a lot of great people that I get to work with, and then just seeing those personal stories, like, you know, knowing how it's helped people and keeping the family members at home, and it just really takes the burden off of, you know, the spouse or the adult children that are trying to work, keeping people at home instead of going into a nursing home.
I'm so glad that you mentioned that. So if I can just tell another story. The other thing that we're seeing with elders across the country is that dementia. Let's talk about that. It's being diagnosed earlier. We're recognizing it earlier, which is wonderful, and that we can try to get ahead of things. We at the Hope program, we can really serve that population as well. And there's a need for that in Wichita. So we have loved ones that their doctors are saying, you know, they need 24-hour supervision. They have dementia. They need more care. And then, okay, what does that mean? I still work. I still have to do things. What does that mean? We can help provide support on that too. And the story I always, that kind of kept me going at the beginning and still does now, is I met with a gentleman down in Hayesville, and his wife had gotten that diagnosis, and he worked. And he looked at me, he said, I promised my wife when I married her, in sickness or in health, can you help me help her? Because I am her husband, and I promised her I would care for her. What do I do? And that was really, I mean, it was really emotional for me, because that is some serious dedication and an expression of that love. And so the family was coming in and helping as best they could, but she needed more care. So what we were able to do is we put home care in there, so he could go to work in the morning. And then she would come in on our bus, and she comes in 5 days a week. We have a center that is for her, for folks that need that little bit of extra care. She's still doing activities. We're making sure she's getting a shower, she's getting fed. And he came to me a few months after the program and said, you know, thank you. You know, she's getting medication. I'm talking to her doctors. The nurse understands. Her home care aide is great. And so then he felt like he had support too. And she did really well in her program. You know, even though what the expectation was maybe was a little bit more limited on what she could enjoy or thrive in, she still can be in a life. She can still enjoy her life. Her family can still feel supported. And she was able to be in our program for 6 years before she passed away. And it was such just an honor and a privilege to be able to provide that too. So for folks in the community that are kind of in that place where they don't know where to start and are feeling overwhelmed, PACE is another way that they can get that support that they need, that we can take care of really well.
And that's good to know. So remind our listeners, if they want more information, where they can go for that.
Go to www.kansaspace.org. There's also a phone number on the website that people can call, and that phone is answered 24/7. It will direct them to any of the organizations in the state that are providing PACE. So they can put in their zip code, they can tell the phone operator. So there's a couple different ways there that they can get connected. We'll have people that go out and meet with them, tell them about the PACE program, give them all the information, and then they decide if this is a good fit for them.
That's awesome. And for locals?
Yes. Yes. So Ascension Living Hope, we're down at Central McLean, just past those neon things over by the old Central
Yes.
Riverside Hospital. We're over there. Drop by anytime, Monday through Friday, 775 North Edwards, or give us a call, 858-1111, and they'll connect you with Natalie, who works on my team, and she can tell you about the program. And she's also bilingual. She speaks English and Spanish, so if that's helpful, and then we'll come visit with you locally and let you know about the program and get you connected.
Thank you. Well,
Thank
guys,
you.
I can tell y'all from like my end, y'all made me feel a little bit more comfortable and secure.
Wonderful.
About, parents moving here and everything. Like, this was such great information to learn.
you.
And y'all are doing incredible work, and I appreciate y'all so much. So thank you so much for stopping by.
Thank you.
Thanks for having us.
Well, guys, this is another episode. Thank you so much, and we will see you soon.